Dr. Steve, your favorite physical therapist here. So your doctor said you need to have a manipulation under anesthesia. Now what? Let's talk about it. Number one, and this is very important, you've probably had a very tough, last 6, 7, 8 weeks, and you are not broken. This happens from time to time. There's been a lot of research on why do some people scar down faster than others? How come some people don't get as good a range of motion as others? The flat answer is we don't know. We're researching it. We're trying to figure out why. But what we do know is that people who get MUAs tend to have a positive outcome afterward. I know you've had a rough 6 weeks. Look, you're not broken. This just happens in some people. We're not sure why, but we do know that most people that get MUAs tend to have a good outcome. Number two, I would talk to my surgeon and develop a plan of what are you going to do differently from a medical standpoint. So that might be changing up your medication regimen. Let's say your biggest limitation or one of the biggest speed bumps was pain. I would talk to my doctor about changing up my pain medication regimen. Maybe it was swelling. Talk to your doctor about or how you were managing your swelling. Maybe there's some sort of compression device that you can get, or a different type of TED hose, different levels of compression. What are you going to do differently from a medical standpoint? Maybe your doctor orders even more therapy. That might be what they can do. The number three is I would actually talk to my therapist that I was working with. Just because you had an MUA doesn't mean your therapy totally failed. It means that plan of care wasn't successful. You need to figure out a new approach and a new way of going about things. So I would talk to my physical therapist and say, look, what are we going to do differently this time? Maybe it's a different home exercise program, emphasizing different things. You don't need to go find a new physical therapist and kind of burn everything down. But I would be upfront and say, look, I want to do something different because clearly it did not work out. Figure out a new plan. Talk to your doctor, talk to your therapist, change some things up this time around. Don't panic, and you're most likely, you're going to be okay. The research behind these is very positive. You tend to do very well.